Question 1. The performance metrics show a consistent decline in feed conversion ratios and an increase in respiratory lesions across multiple flocks housed in a large-scale broiler operation. Initial observations suggest no overt signs of infectious disease outbreaks, but the air quality monitoring data from the barns indicates elevated levels of ammonia and particulate matter, particularly during periods of high humidity and reduced ventilation. Considering the potential impact on poultry health and productivity, which of the following approaches best aligns with a comprehensive impact assessment under U.S. regulatory and professional guidelines for poultry veterinarians? Option A. Attribute the performance decline solely to genetic factors or feed formulation issues and recommend adjustments to the feed ration without further investigation into the environmental parameters. Option B. Immediately implement a broad-spectrum antibiotic treatment protocol for all affected flocks to address potential subclinical respiratory infections exacerbated by environmental conditions. Option C. Disregard the air quality data as secondary to disease prevalence and focus exclusively on post-mortem examination findings for diagnosis and treatment. Option D. Conduct a detailed environmental audit focusing on ventilation system efficiency, litter moisture content, and manure management practices, correlating these findings with the air quality data and observed performance issues to identify specific sources of ammonia and particulate matter. Correct answer is D. Conduct a detailed environmental audit focusing on ventilation system efficiency, litter moisture content, and manure management practices, correlating these findings with the air quality data and observed performance issues to identify specific sources of ammonia and particulate matter. Explanation. This scenario presents a professional challenge due to the need to balance production efficiency with animal welfare and regulatory compliance, specifically concerning air quality. The veterinarian must interpret complex performance data and correlate it with potential environmental stressors, requiring a nuanced understanding of poultry physiology and the impact of air pollutants. The challenge lies in moving beyond simple symptom identification to a root cause analysis that considers multiple contributing factors, including ventilation, litter management, and potential pathogen loads, all within the framework of U.S. federal and state regulations governing animal agriculture and environmental protection. The correct approach represents best professional practice because it prioritizes a systematic, data-driven investigation that directly addresses the observed performance decline by evaluating air quality parameters in relation to established U.S. poultry production guidelines and relevant environmental standards. This proactive and comprehensive assessment ensures that interventions are targeted, effective, and compliant with regulations such as those potentially enforced by the Environmental Protection Agency, EPA, concerning ammonia emissions or state-level agricultural best management practices. It demonstrates a commitment to animal health and welfare, which is ethically and professionally mandated. An incorrect approach that focuses solely on feed conversion ratios without investigating the underlying environmental factors fails to address the potential root cause of the performance deficit. This oversight could lead to misdiagnosis and ineffective treatment strategies, potentially prolonging animal suffering and economic losses, and could be considered a failure to meet the standard of care expected of a veterinarian. Another incorrect approach that dismisses the air quality data as irrelevant without a thorough investigation ignores the well-documented impact of environmental stressors like ammonia, dust, and carbon dioxide on poultry respiratory health, immune function, and overall productivity. This could represent a failure to adhere to professional guidelines that emphasize environmental management as a critical component of flock health. A third incorrect approach that suggests immediate, broad-spectrum antibiotic use without identifying a specific bacterial pathogen or a clear link to air quality issues is ethically questionable and potentially non-compliant with antimicrobial stewardship principles. It bypasses a crucial diagnostic step and could contribute to antimicrobial resistance, a significant public health concern. The professional decision-making process in such situations should involve 1. Thorough review of all available performance data. 2. Systematic environmental assessment, including air quality monitoring. 3. Correlation of environmental findings with animal health and performance indicators. 4. Consultation of relevant U.S. regulatory guidelines and scientific literature. 5. Development of a targeted intervention plan. And 6. ongoing monitoring and evaluation of the plan's effectiveness. This structured approach ensures that decisions are evidence-based, ethically sound, and legally compliant. Question 2. Regulatory review indicates that a large commercial poultry operation has reported a recent increase in unexplained mortality and reduced feed conversion ratios. The producer, concerned about potential production losses and the cost of extensive biosecurity upgrades, requests a rapid, minimal-cost assessment of their biosecurity protocols, emphasizing a desire to avoid any significant operational disruptions. As the consulting veterinarian, what is the most ethically and regulatorily sound approach to evaluating the effectiveness of their biosecurity program under U.S. federal and state poultry health regulations? Option A. Implement a standardized, pre-designed biosecurity checklist for the farm without conducting a specific risk assessment or considering the unique operational characteristics of the facility. Option B. Advise the producer to temporarily halt all incoming birds and materials until a full biosecurity overhaul can be completed, regardless of the immediate economic impact. Option C. Conduct a comprehensive on-site audit of all biosecurity protocols, including personnel movement, vehicle traffic, pest control, and raw material sourcing, to identify specific vulnerabilities and recommend targeted, evidence-based improvements, even if these involve initial costs or minor operational adjustments. Option D. Accept the producer's assurances that their existing biosecurity measures are generally adequate and focus solely on treating the symptoms of the increased mortality and reduced feed conversion. The correct answer is C. Conduct a comprehensive on-site audit of all biosecurity protocols, including personnel movement, vehicle traffic, pest control, and raw material sourcing, to identify specific vulnerabilities and recommend targeted, evidence-based improvements, even if these involve initial costs or minor operational adjustments. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a veterinarian to balance the immediate economic pressures of a producer with the long-term public health and animal welfare implications of biosecurity. The producer's desire to minimize disruption and cost, while understandable from a business perspective, directly conflicts with the veterinarian's ethical and regulatory obligation to ensure effective biosecurity measures are in place to prevent disease spread. The veterinarian must navigate this conflict without compromising professional integrity or violating regulatory requirements. Correct approach analysis. The correct approach involves a thorough, evidence-based evaluation of the existing biosecurity protocols, identifying specific weaknesses, and proposing targeted, practical improvements. This aligns with the veterinarian's professional responsibility to provide sound advice based on scientific principles and regulatory guidelines. By focusing on objective data and risk assessment, the veterinarian upholds the highest standards of animal health, public health, and food safety, which are paramount under the regulatory framework governing veterinary practice and poultry production. This approach prioritizes disease prevention and control, which is a core tenet of veterinary public health and a key objective of biosecurity regulations. Incorrect approaches analysis. One incorrect approach involves accepting the producer's assurances without independent verification. This fails to meet the veterinarian's duty of care and regulatory obligation to actively assess and ensure biosecurity effectiveness. It risks overlooking critical vulnerabilities that could lead to disease outbreaks, impacting animal welfare, economic viability, and potentially public health. Ethically, it represents a dereliction of professional duty. Another incorrect approach is to implement a generic, one-size-fits-all biosecurity plan without considering the specific risks and operational realities of the farm. This approach is ineffective because it may not address the most significant threats to that particular operation, leading to a false sense of security. It also fails to demonstrate due diligence in tailoring recommendations to the specific context, which is often an implicit or explicit requirement of regulatory compliance and best practice. A third incorrect approach is to prioritize immediate cost savings over comprehensive risk mitigation. While economic considerations are important, they should not supersede the fundamental requirements of biosecurity. This approach could lead to the adoption of superficial or inadequate measures that fail to prevent disease introduction or spread, ultimately resulting in greater economic losses and potential regulatory penalties if an outbreak occurs. It also undermines the veterinarian's role as a trusted advisor focused on long-term health and safety. Professional reasoning. Professionals should approach such situations by first understanding the producer's concerns and constraints. However, this understanding must be coupled with a firm commitment to regulatory compliance and ethical obligations. The decision-making process should involve 1. Clearly defining the scope of the biosecurity evaluation based on relevant regulations and best practices. 2. Gathering objective data through farm audits, record reviews, and discussions with farm personnel. 3. Conducting a risk assessment to identify the most critical biosecurity vulnerabilities. 4. Developing a prioritized list of recommendations that are both effective and practical for the specific operation. 5. Communicating these findings and recommendations clearly to the producer, explaining the rationale and potential consequences of inaction, while also exploring cost-effective solutions where possible without compromising effectiveness. 6. Documenting all assessments, recommendations, and communications thoroughly. Question 3. The assessment process reveals a situation where a commercial broiler operation is experiencing increased mortality and reduced feed conversion ratios attributed to a specific respiratory pathogen. The veterinarian must recommend a vaccination strategy. Considering the U.S. regulatory framework for veterinary biologics, which approach to vaccine selection demonstrates the most robust professional judgment and adherence to established guidelines. Option A. Recommend the use of an inactivated vaccine that has been historically used on the farm for this pathogen, even if newer, potentially more efficacious live vaccines are available, to maintain consistency in the vaccination program. Option B. Choose a subunit vaccine based solely on its ease of administration via drinking water, without a thorough evaluation of its immunogenicity, duration of immunity, or approval status by the USDA CVB for the specific pathogen and broiler age. Option C. Advise the client to source a vaccine from a foreign manufacturer that is not approved by the USDA CVB, citing anecdotal evidence of its effectiveness in other regions to potentially reduce costs. Option D. Select a live attenuated vaccine that has demonstrated broad-spectrum efficacy against the target pathogen in similar broiler populations, ensuring it is approved by the USDA Center for Veterinary Biologics, CVB, for use in broilers, and administered according to label instructions to elicit a rapid and protective immune response. The correct answer is D. Select a live attenuated vaccine that has demonstrated broad-spectrum efficacy against the target pathogen in similar broiler populations, ensuring it is approved by the USDA Center for Veterinary Biologics, CVB, for use in broilers, and administered according to label instructions to elicit a rapid and protective immune response. Explanation. The assessment process reveals a common challenge in poultry health management, selecting the most appropriate vaccine type for a specific disease outbreak in flock. This scenario is professionally challenging because the veterinarian must balance efficacy, cost, administration methods, and potential for adverse reactions, all within the context of U.S. regulatory frameworks governing veterinary biologics. The decision directly impacts flock health, economic viability, and public health. The correct approach represents best professional practice because it prioritizes a science-based, risk-assessed decision. This involves a thorough understanding of the specific pathogen, the available vaccine technologies, live attenuated, inactivated, subunit, vector, their immunogenicity, duration of immunity, and potential for reversion to virulence or shedding. It also necessitates considering the flock's age, immune status, production stage, and the prevailing epidemiological situation, aligning with the principles of responsible veterinary medicine and the guidelines set forth by the USDA Center for Veterinary Biologics, CVB, for vaccine approval and use. Adherence to CVB regulations ensures that vaccines are safe, pure, potent, and effective, minimizing risks to animal and human health. An incorrect approach that relies solely on historical practice without reevaluation fails to account for evolving disease dynamics, new vaccine technologies, or changes in regulatory guidance. This could lead to suboptimal protection, increased disease incidence, and potential economic losses, violating the veterinarian's ethical duty to provide competent care. Another incorrect approach, such as prioritizing the cheapest available vaccine without considering its efficacy or suitability for the specific challenge, represents a failure in professional judgment and potentially a violation of the veterinarian's responsibility to act in the best interest of the animal and client. This could also lead to the use of a product not adequately approved or regulated by the CVB for the intended purpose. A third incorrect approach, focusing exclusively on a single vaccine type without considering alternatives, demonstrates a lack of comprehensive knowledge and a failure to adapt to the nuances of poultry immunology and vaccine science, potentially leading to an ineffective vaccination program. The professional reasoning process should involve a systematic evaluation of the disease threat, including pathogen identification and virulence. This should be followed by a review of available vaccine options, considering their mechanism of action, administration route, expected immune response, and duration of immunity, all within the framework of USDA CVB-approved products. Risk assessment, considering factors like flock age, stress, co-infections, and environmental conditions, is crucial. Finally, consultation with diagnostic laboratories, industry experts, and relevant regulatory bodies, like the CVB, ensures informed decision-making that maximizes flock health and minimizes risks. Question 4. Cost-benefit analysis shows that implementing a phased feeding program, precisely adjusting nutrient profiles for broiler chickens at starter, grower, and finisher stages, is more economically advantageous than using a single, generic feed formulation throughout their growth cycle. Which of the following approaches best reflects the veterinarian's professional responsibility in this context, considering optimal nutritional needs at different life stages? Option A. Develop and recommend a detailed, multi-stage feeding program that aligns nutrient specifications with the distinct physiological requirements of each growth phase, ensuring optimal health and performance while managing costs. Option B. Implement a single, all-purpose feed formulation that provides a baseline level of nutrients, believing that the birds will compensate for any deficiencies through their natural foraging behaviors. Option C. Focus solely on reducing overall feed costs by lowering the concentration of key nutrients across all life stages, rationalizing that slight undernutrition is acceptable if it leads to immediate savings. Option D. Advocate for the use of the least expensive feed ingredients available, assuming that minor variations in nutrient intake will not significantly impact flock health or productivity in the long term. Correct answer is A. Develop and recommend a detailed, multi-stage feeding program that aligns nutrient specifications with the distinct physiological requirements of each growth phase, ensuring optimal health and performance while managing costs. Explanation. This scenario presents a common implementation challenge in poultry production, balancing optimal nutritional strategies with economic realities. The challenge lies in the dynamic nature of poultry nutritional needs across different life stages, from rapid growth in broilers to egg production in layers, and the potential for over- or undernutrition to impact flock health, performance, and ultimately, profitability. The veterinarian must navigate these complexities while adhering to established veterinary standards and regulatory guidelines concerning animal welfare and feed safety. The correct approach represents best professional practice because it prioritizes a science-based, evidence-driven strategy tailored to the specific physiological requirements of the birds at each developmental stage. This involves understanding the metabolic demands for energy, protein, amino acids, vitamins, and minerals, and how these change. Implementing a phased feeding program ensures that the birds receive the precise nutrients needed for optimal growth, feathering, immune function, and reproductive performance, thereby minimizing waste and maximizing efficiency. This aligns with the veterinarian's ethical obligation to promote animal health and welfare, and implicitly with regulatory frameworks that aim to ensure efficient food production and prevent disease outbreaks linked to nutritional deficiencies or excesses. An incorrect approach that focuses solely on the cheapest available feed ingredients without regard for specific life stage requirements represents a significant regulatory and ethical failure. This could lead to suboptimal growth, increased susceptibility to disease due to compromised immune function, and poor feed conversion ratios, all of which negatively impact animal welfare and economic viability. Furthermore, it may violate regulations pertaining to animal health and the responsible use of feedstuffs. Another incorrect approach that relies on a single, generic feed formulation for all life stages ignores the fundamental principles of poultry nutrition. This would inevitably lead to deficiencies in some nutrients and excesses in others, resulting in impaired performance and potential health issues. This approach fails to meet the professional standard of care expected of a veterinarian and could be seen as a dereliction of duty in ensuring the well-being of the flock. A third incorrect approach that prioritizes short-term cost savings by reducing nutrient levels below established requirements, even if the birds appear outwardly healthy, is also professionally unacceptable. While overt signs of deficiency may not be immediately apparent, such practices can lead to subclinical issues, reduced stress resilience, and long-term impacts on flock productivity and health. This approach demonstrates a lack of understanding of the subtle but critical role of precise nutrition and could be considered a failure to uphold animal welfare standards. A professional decision-making process for similar situations should involve a thorough assessment of the flock's current life stage and production goals. This includes consulting current scientific literature and established nutritional guidelines for the specific poultry species and breed. A cost-benefit analysis should then be conducted, not just on feed cost, but on the overall economic impact of different nutritional strategies, considering feed conversion, growth rates, egg production, mortality, and disease incidence. Collaboration with nutritionists and farm managers is crucial to develop and implement a phased feeding program that is both nutritionally sound and economically feasible, always prioritizing animal health and welfare within the applicable regulatory framework. Question 5. Implementation of a diagnostic strategy for a commercial broiler flock exhibiting sudden onset of respiratory distress, lethargy, and increased mortality, where the veterinarian must consider potential reportable diseases under U.S. federal and state regulations. What is the most appropriate initial approach to field diagnostics? Option A. Conduct a thorough clinical examination of affected and unaffected birds. Form a systematic necropsy on a representative sample of deceased birds, and collect appropriate tissues for submission to a state or federal diagnostic laboratory for confirmatory testing. Option B. Advise the producer to cull the entire flock to prevent potential spread, without conducting a detailed clinical examination or necropsy to identify the specific etiological agent. Option C. Presumptively diagnose the condition based on the most common respiratory disease in the region, and advise the producer on supportive care and biosecurity measures without further laboratory investigation. Option D. Immediately implement broad-spectrum antibiotic therapy based on initial clinical signs and postpone necropsy and laboratory diagnostics until mortality significantly decreases. The correct answer is A. Conduct a thorough clinical examination of affected and unaffected birds, perform a systematic necropsy on a representative sample of deceased birds, and collect appropriate tissues for submission to a state or federal diagnostic laboratory for confirmatory testing. Explanation. This scenario presents a professional challenge due to the inherent variability of clinical signs and necropsy findings in field poultry diagnostics, compounded by the need to adhere strictly to U.S. regulatory frameworks governing disease reporting and response. The veterinarian must balance rapid assessment for immediate flock welfare with the legal obligations to accurately identify and report potential reportable diseases. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based diagnostic process that aligns with U.S. Department of Agriculture, USDA Animal and Plant Health Inspection Service, APHI's, guidelines and state veterinary practice acts. This involves thorough clinical observation, meticulous necropsy, and appropriate sample collection for confirmatory laboratory testing. This approach ensures accurate diagnosis, facilitates timely and correct reporting of any suspect reportable diseases, and supports effective disease control measures, thereby protecting public health and the poultry industry. An incorrect approach that relies solely on presumptive diagnoses based on limited clinical signs or gross necropsy findings, without laboratory confirmation, fails to meet the standard of care and regulatory requirements. This could lead to misdiagnosis, delayed or incorrect reporting of reportable diseases, and potentially the spread of disease due to inadequate control measures. Ethically, it violates the veterinarian's duty to provide competent care and uphold public trust. Another incorrect approach that involves delaying diagnostic procedures or sample submission due to time constraints or perceived cost savings is also professionally unacceptable. This can result in the irreversible loss of critical diagnostic evidence, hindering accurate diagnosis, and potentially allowing a disease outbreak to escalate. It also compromises the ability to fulfill legal reporting obligations in a timely manner, which is a critical component of U.S. animal health regulations. A further incorrect approach that involves sharing presumptive diagnoses with stakeholders without appropriate caveats or laboratory confirmation can lead to misinformation, panic, and inappropriate actions by producers. This undermines the veterinarian's role as a trusted advisor and can have significant economic and welfare consequences for the affected flock and potentially other operations. The professional decision-making process for similar situations should involve a structured approach. 1. Initial assessment of clinical signs and environmental factors. 2. A comprehensive necropsy, systematically documenting all gross lesions. 3. Consideration of differential diagnoses based on the observed findings. 4. Prioritization of sample collection for laboratory confirmation, especially for suspected reportable diseases. 5. Consultation with diagnostic laboratories and regulatory authorities as needed. 6. Clear communication of findings and diagnostic plan to stakeholders, emphasizing the need for laboratory confirmation before definitive diagnoses are made, particularly for diseases with regulatory implications. Question 6. Quality control measures reveal an unexpected increase in the prevalence of a specific respiratory syndrome in a commercial broiler flock, exceeding the established alert threshold for the region. The initial data is derived from routine flock health monitoring and does not yet include confirmatory laboratory diagnostics for a specific pathogen. Which of the following represents the most appropriate immediate next step for the responsible veterinarian? Adhering strictly to U.S. regulatory frameworks for animal disease surveillance and monitoring. Option A. Advise the producer to implement broad-spectrum antibiotic treatment across all affected and neighboring flocks to mitigate the syndrome's impact. Option B. Recommend immediate depopulation of the affected flock and all neighboring flocks to prevent potential spread, as per emergency disease control protocols. Option C. Classify the elevated prevalence as a potential false positive or minor fluctuation, and advise the producer to continue routine monitoring without further immediate action. Option D. Immediately initiate a comprehensive diagnostic investigation, including sample submission to accredited laboratories for pathogen identification, and consult with state and federal veterinary authorities to assess the epidemiological implications. Correct answer is D. Immediately initiate a comprehensive diagnostic investigation, including sample submission to accredited laboratories for pathogen identification, and consult with state and federal veterinary authorities to assess the epidemiological implications. Explanation. Scenario analysis. This scenario presents a challenge in interpreting and acting upon surveillance data that indicates a potential deviation from expected disease prevalence. The veterinarian must balance the need for timely intervention to protect flock health and prevent economic losses with the imperative to avoid unnecessary panic, resource misallocation, and disruption to trade based on potentially transient or non-significant findings. The pressure to provide definitive answers quickly, coupled with the inherent variability in biological systems, necessitates a rigorous and systematic approach to data interpretation and response. Correct approach analysis. The correct approach emphasizes a multifaceted investigation that aligns with established U.S. regulatory frameworks for animal disease surveillance, such as those outlined by the USDA's Animal and Plant Health Inspection Service, APHIS. This involves confirming the initial findings through diagnostic testing, assessing the epidemiological context, e.g., flock history, biosecurity measures, geographic proximity to other affected flocks, and consulting with relevant regulatory authorities. This systematic process ensures that any subsequent actions are evidence-based, proportionate, and compliant with federal and state regulations governing disease reporting and control. It prioritizes accurate diagnosis and risk assessment before implementing potentially disruptive control measures, thereby upholding the integrity of surveillance systems and minimizing economic impact. Incorrect approaches analysis. One incorrect approach involves immediate, widespread depopulation based solely on the initial elevated prevalence without further diagnostic confirmation or epidemiological investigation. This fails to adhere to the principles of due process and evidence-based decision-making mandated by U.S. animal health regulations. Such an action could lead to unwarranted economic losses for producers, unnecessary disruption to the poultry supply chain, and potential accusations of regulatory overreach. It bypasses critical steps in disease investigation, such as sample submission for confirmatory testing and risk assessment, which are fundamental to responsible disease management. Another incorrect approach is to dismiss the elevated prevalence as a statistical anomaly without any further investigation. This neglects the potential for an emerging disease outbreak, which could have significant public health and economic consequences. U.S. surveillance systems are designed to detect such deviations, and ignoring them violates the ethical obligation to protect animal and potentially human health. It also undermines the effectiveness of the surveillance program itself, as it fails to act on signals that may indicate a genuine threat. A third incorrect approach is to implement broad, nonspecific treatment protocols across multiple flocks without a confirmed diagnosis or understanding of the causative agent. This is not only potentially ineffective, but also carries risks of antimicrobial resistance development and is not a recognized component of a surveillance and monitoring system's response. Regulatory frameworks typically require a confirmed diagnosis before initiating specific treatment or control measures, and this approach circumvents that essential step. Professional reasoning. Professionals should approach such situations by first acknowledging the signal from the surveillance system. The next step is to initiate a diagnostic investigation to confirm the nature and cause of the elevated prevalence. Simultaneously, an epidemiological assessment should be conducted to understand the context and potential spread. Communication with regulatory authorities, e.g., state veterinarians, USDA FIs, is crucial at this stage to ensure compliance and coordinated action. The decision-making process should be guided by a risk-based approach, weighing the potential severity of the disease against the likelihood of its presence and the impact of various intervention strategies. This systematic, evidence-driven process ensures that actions are both effective and compliant with U.S. regulatory requirements. Question 7. Process analysis reveals a suspected outbreak of a highly contagious avian pathogen in a large commercial layer operation. The veterinarian is tasked with recommending an immediate course of action to mitigate disease spread and protect public health, considering the potential for significant economic impact on the producer and the broader poultry industry. Which risk assessment approach is most appropriate for guiding the initial response and subsequent management decisions? Option A. An immediate recommendation for depopulation of the entire flock based on the initial positive diagnostic result, prioritizing the elimination of the suspected pathogen at all costs. Option B. A reactive approach that waits for further epidemiological data to emerge and for the disease to manifest more clearly before implementing any control measures. Option C. A comprehensive, multifaceted risk assessment that evaluates the likelihood of transmission, the potential severity of the disease, the effectiveness of existing biosecurity measures, and the economic consequences of various intervention strategies, utilizing data from diagnostics, epidemiology, and expert opinion. Option D. A decision based solely on historical precedents of similar outbreaks in other regions, without specific consideration for the current farm's unique biosecurity, management practices, or diagnostic findings. The correct answer is C. A comprehensive, multifaceted risk assessment that evaluates the likelihood of transmission, the potential severity of the disease, the effectiveness of existing biosecurity measures, and the economic consequences of various intervention strategies, utilizing data from diagnostics, epidemiology, and expert opinion. Explanation. This scenario presents a professionally challenging situation due to the inherent uncertainties in disease transmission dynamics within a complex poultry production system. The veterinarian must balance the need for rapid intervention to control a suspected outbreak with the potential for economic disruption, and the ethical imperative to act based on sound scientific principles and regulatory compliance. Careful judgment is required to select the most appropriate risk assessment approach that aligns with established veterinary public health guidelines and regulatory frameworks governing poultry disease management in the United States. The correct approach represents best professional practice because it systematically evaluates the likelihood and impact of disease transmission, incorporating multiple data sources and expert judgment. This aligns with the principles of risk assessment as outlined by agencies such as the USDA's Animal and Plant Health Inspection Service, APHIS, and the recommendations of professional organizations like the American Association of Avian Pathologists, AAP, which emphasize a science-based, tiered approach to disease control. This method allows for targeted interventions, minimizing unnecessary economic losses while maximizing the effectiveness of disease containment efforts. It also supports transparent communication with stakeholders and regulatory bodies by providing a defensible rationale for decisions. An incorrect approach that relies solely on anecdotal evidence or historical precedent, without a structured risk assessment, fails to meet the professional standard of care. This could lead to misallocation of resources, delayed or ineffective control measures, and potential regulatory noncompliance if actions are not supported by a documented, evidence-based evaluation. For instance, acting solely on a single positive test result without considering the epidemiological context, e.g., prevalence, biosecurity measures, potential for false positives, could result in unnecessary depopulation or movement restrictions, causing significant economic harm and potentially violating principles of animal welfare and responsible resource management. Another incorrect approach that focuses exclusively on the most severe potential outcome without adequately assessing its probability is also professionally unacceptable. While preparedness for worst-case scenarios is important, a risk assessment must weigh both the likelihood and the consequence. Overemphasizing low probability, high-impact events without a balanced evaluation can lead to disproportionate and costly interventions that do not reflect the actual risk. This can also undermine confidence in the veterinarian's judgment and lead to regulatory scrutiny if decisions appear arbitrary or not grounded in a comprehensive risk analysis. The professional decision-making process for similar situations should involve a systematic risk assessment framework. This typically includes hazard identification, identifying the potential disease agent, dose response assessment, understanding the relationship between exposure and disease, exposure assessment, evaluating the likelihood and extent of contact with the agent, and risk characterization, integrating the previous steps to estimate the overall risk. This process should be iterative, allowing for adjustments as new information becomes available. Collaboration with diagnostic laboratories, regulatory officials, and other veterinarians is crucial for gathering comprehensive data and ensuring alignment with established protocols and legal requirements. Question 8. Governance review demonstrates that a veterinarian is presented with a flock of commercial layers exhibiting sudden onset of high mortality, respiratory signs, and decreased egg production. Preliminary field observations are highly suggestive of either highly pathogenic avian influenza, HPI, or virulent Newcastle disease, VND. According to the regulatory framework governing animal health in the United States, what is the veterinarian's immediate and primary obligation upon forming this suspicion? Option A. Advise the producer on enhanced biosecurity measures and monitor the situation for further developments. Option B. Inform the producer of the potential diagnosis and recommend immediate depopulation of the affected flock. Option C. Conduct extensive in-house diagnostic testing to confirm the specific viral agent before reporting. Option D. Immediately notify the USDA Animal and Plant Health Inspection Service, APHIS, and the relevant state veterinarian. The correct answer is D. Immediately notify the USDA Animal and Plant Health Inspection Service, APHIS, and the relevant state veterinarian. Explanation. Scenario analysis. This scenario is professionally challenging due to the immediate and severe economic and public health implications of an avian influenza, AI, or Newcastle disease, ND, outbreak. The veterinarian must balance the need for rapid, accurate diagnosis and containment with the potential for significant disruption to the poultry industry and trade. The pressure to act decisively, coupled with the inherent uncertainties of disease spread and the need to adhere to stringent regulatory protocols, requires careful judgment. Missteps can lead to widespread disease, economic losses, and regulatory penalties. Correct approach analysis. The correct approach involves immediate notification of the relevant state and federal veterinary authorities, specifically the USDA Animal and Plant Health Inspection Service, APHIS, for AI and ND in the U.S. This aligns directly with the requirements of the Animal Health Protection Act, APA, and associated regulations, which mandate reporting of suspected or confirmed cases of reportable diseases. Prompt reporting allows for coordinated response, epidemiological investigation, implementation of control measures, quarantine, depopulation, disinfection, and access to federal resources and expertise. This proactive engagement with regulatory bodies is crucial for effective disease management and minimizing economic impact, fulfilling the veterinarian's ethical and legal obligations. Incorrect approaches analysis. One incorrect approach would be to delay reporting to gather more definitive diagnostic evidence independently. This violates the APA and APHI's guidelines, which emphasize immediate reporting upon suspicion. Such delay allows the disease to spread unchecked, increasing the potential for a larger outbreak, greater economic damage, and potential penalties for noncompliance. It also undermines the coordinated national response efforts. Another incorrect approach would be to only inform the farm owner and implement biosecurity measures without involving regulatory authorities. While biosecurity is vital, it is insufficient as a sole response to a reportable disease. This failure to report is a direct violation of federal law and APHI's regulations, potentially leading to severe legal repercussions for both the veterinarian and the producer. It also prevents the implementation of necessary public health and trade-related measures. A third incorrect approach would be to rely solely on anecdotal evidence or historical experience without initiating the formal diagnostic and reporting process. While experience is valuable, it does not substitute for the legally mandated diagnostic confirmation and reporting procedures for diseases like AI and ND. This approach risks misdiagnosis, delayed intervention, and failure to comply with federal reporting requirements, all of which have serious consequences. Professional reasoning. Professionals should utilize a decision-making framework that prioritizes regulatory compliance and public health. This involves 1. Recognizing the potential for a reportable disease based on clinical signs and epidemiological context. 2. Immediately consulting relevant U.S. federal regulations, e.g., APA and APHI's guidelines for reportable diseases. 3. Initiating appropriate diagnostic sampling according to established protocols. 4. Promptly reporting suspicions to state and federal veterinary authorities. 5. Collaborating with these authorities throughout the investigation and control process. This systematic approach ensures legal adherence, facilitates effective disease containment, and upholds professional responsibility. Question 9. Investigation of a sudden decline in egg production and increased mortality in a commercial layer flock, with preliminary observations suggesting potential feather abnormalities and reduced feed intake, prompts a veterinarian to consider the impact of specific nutrient deficiencies. Which of the following diagnostic and intervention strategies best aligns with U.S. regulatory frameworks and sound veterinary practice for addressing suspected nutritional issues in poultry? Option A. Conduct a comprehensive analysis of the current feed formulation for all essential macro and micronutrients. Compare the results against established poultry nutritional requirements, and consult with the feed manufacturer regarding any recent ingredient changes or quality control issues. Option B. Immediately administer broad-spectrum antibiotics and a vitamin-mineral supplement to the entire flock to address potential underlying infections and general nutritional support. Option C. Rely on anecdotal reports from other producers about similar symptoms and suggest the use of unverified herbal supplements purported to improve egg production. Option D. Recommend the producer switch to a completely different feed source from a new supplier without further analysis of the current feed or the flock's specific needs. The correct answer is A. Conduct a comprehensive analysis of the current feed formulation for all essential macro and micronutrients. Compare the results against established poultry nutritional requirements, and consult with the feed manufacturer regarding any recent ingredient changes or quality control issues. Explanation. This scenario presents a professional challenge due to the potential for significant economic losses and animal welfare concerns stemming from a subtle but impactful nutritional deficiency. The veterinarian must not only identify the likely cause, but also recommend interventions that are both effective and compliant with U.S. regulatory frameworks governing animal feed and veterinary practice. The complexity arises from the need to balance diagnostic accuracy with the practicalities of feed formulation and the potential for widespread impact across a flock. The correct approach represents best professional practice because it directly addresses the suspected nutritional deficiency through a systematic, evidence-based methodology. It prioritizes a thorough evaluation of the feed's composition and the flock's physiological status, aligning with the principles of veterinary diagnostics and the requirements of the U.S. Food and Drug Administration, FDA, for animal feed safety and efficacy. This approach ensures that any corrective measures are targeted, scientifically sound, and minimize the risk of unintended consequences, thereby upholding professional responsibility and adhering to guidelines that prevent adulteration or misbranding of animal feed. An incorrect approach that focuses solely on symptomatic treatment fails to address the root cause of the problem, which is the nutritional deficiency. This is professionally unacceptable as it is unlikely to resolve the underlying issue and may lead to prolonged suffering for the birds and continued economic losses for the producer. Ethically, it deviates from the veterinarian's duty to provide effective care. Another incorrect approach that involves immediate, drastic changes to the entire feed formulation without proper analysis risks introducing new nutritional imbalances or toxicity, potentially exacerbating the problem. This violates the principle of prudent veterinary practice and could lead to non-compliance with feed additive regulations if new, unapproved substances are introduced. A third incorrect approach that relies on anecdotal evidence or unverified supplements bypasses established scientific protocols and regulatory oversight. This is ethically problematic as it exposes the flock to unproven treatments and may involve products not approved by the FDA for use in animal feed, potentially leading to violations of the Federal Food, Drug, and Cosmetic Act, FFDCA. The professional reasoning process should involve a structured diagnostic approach. First, gather detailed history and observe clinical signs. Second, conduct a thorough physical examination of the flock. Third, collect and analyze feed samples for nutrient content, comparing them against established poultry nutritional requirements as outlined by recognized scientific bodies and potentially referenced in FDA guidelines for feed formulation. Fourth, consider diagnostic testing of affected birds if indicated. And finally, develop a targeted intervention plan based on the confirmed diagnosis, ensuring all feed amendments comply with FDA regulations regarding feed additives and labeling. Question 10. What factors determine the most effective and regulatory compliant strategy for investigating and controlling a suspected disease outbreak in a commercial poultry flock, considering biosecurity, environmental conditions, and recent flock introductions? Option A. Immediate implementation of broad-spectrum antimicrobial therapy based on presumptive clinical signs, without a detailed investigation into the underlying causes. Option B. Comprehensive epidemiological investigation that systematically evaluates biosecurity protocols, vaccination history, environmental management, and recent introductions of birds, in conjunction with appropriate diagnostic testing. Option C. Relying solely on the producer's anecdotal reports of bird behavior and mortality without independent veterinary assessment or diagnostic confirmation. Option D. Prioritizing immediate economic interventions, such as culling unaffected birds, to contain perceived losses before a definitive diagnosis or epidemiological assessment is completed. The correct answer is B. A comprehensive epidemiological investigation that systematically evaluates biosecurity protocols, vaccination history, environmental management, and recent introductions of birds, in conjunction with appropriate diagnostic testing. Explanation. This scenario presents a professional challenge because a veterinarian must balance the immediate need to control a potential disease outbreak with the long-term economic viability and welfare of the poultry operation. The decision-making process requires a thorough understanding of disease epidemiology, biosecurity principles, and the specific regulatory landscape governing poultry health in the United States, as defined by relevant USDA and state veterinary regulations. The veterinarian must also consider the practical limitations and resources available to the producer. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based investigation of potential risk factors. This aligns with the ethical and regulatory obligations of a veterinarian to protect animal health and public health. By focusing on biosecurity protocols, vaccination status, environmental conditions, and recent introductions of birds, the veterinarian is employing a comprehensive risk assessment strategy. This proactive and thorough approach is crucial for identifying the root causes of the outbreak, implementing effective control measures, and preventing future occurrences, thereby upholding the standards of care expected by the American College of Poultry Veterinarians and regulatory bodies. An incorrect approach that relies solely on empirical treatment without investigating underlying causes fails to address the fundamental issues driving the outbreak. This could lead to recurring problems, increased economic losses, and potential spread of disease, violating the veterinarian's duty to provide competent care and potentially contravening regulations that mandate disease reporting and control. Another incorrect approach that dismisses the producer's observations without objective evaluation demonstrates a lack of collaborative problem-solving and may overlook critical information, hindering effective diagnosis and management. Furthermore, an approach that prioritizes immediate economic relief over a thorough epidemiological investigation could lead to suboptimal or ineffective interventions, potentially exacerbating the outbreak and failing to meet professional standards. The professional decision-making process for similar situations should involve a structured approach. 1. Gather comprehensive history, including clinical signs, mortality patterns, feed and water intake, environmental conditions, and management practices. 2. Conduct a thorough physical examination of affected and unaffected birds. 3. Implement appropriate diagnostic testing based on the differential diagnoses. 4. Critically evaluate biosecurity measures and identify potential breaches. 5. Consider environmental factors and their potential impact. 6. Collaborate closely with the producer to understand their operational constraints and resources. 7. Develop a phased management plan that addresses immediate control measures and long-term prevention strategies, ensuring compliance with all relevant U.S. federal and state poultry health regulations. Question 11. When evaluating vaccination strategies for a commercial broiler operation in the United States, which approach best balances disease prevention, economic viability, and regulatory compliance? Option A. Continuing with the same vaccination schedule that has been used historically for the past decade, assuming it has been adequate in the past. Option B. Selecting the least expensive vaccine available for each targeted disease, regardless of its specific efficacy data or route of administration. Option C. Prioritizing the use of the most complex multi-component vaccine available, even if it exceeds the immediate disease risks identified for the operation. Option D. Implementing a risk-based vaccination program developed through a thorough assessment of the flock's health status, prevalent disease challenges, available vaccine options, and the specific production environment, in consultation with the producer and adhering to USDA CVB guidelines. The correct answer is D. Implementing a risk-based vaccination program developed through a thorough assessment of the flock's health status, prevalent disease challenges, available vaccine options, and the specific production environment, in consultation with the producer and adhering to USDA CVB guidelines. Explanation. This scenario is professionally challenging because the veterinarian must balance the immediate need for disease control with the long-term implications of vaccination efficacy, potential for resistance development, and economic viability for the producer. The decision-making process requires a thorough understanding of poultry immunology, epidemiology, specific pathogen characteristics, and the regulatory landscape governing vaccine use in the United States. Careful judgment is required to select a strategy that is both effective in preventing disease and compliant with U.S. regulations and ethical veterinary practice. The correct approach represents best professional practice because it prioritizes a data-driven, risk-based strategy aligned with U.S. regulatory expectations for animal health. This involves a comprehensive assessment of the flock's health status, the prevalence and impact of target diseases, the available vaccine options, considering efficacy, safety, and route of administration, and the specific production environment. This approach ensures that vaccination decisions are scientifically sound, economically justifiable, and contribute to overall flock health and biosecurity, adhering to the principles of responsible veterinary medicine, as outlined by the American College of Poultry Veterinarians, and relevant U.S. regulatory bodies such as the USDA Center for Veterinary Biologics, CVB, for vaccine licensing and approval. An incorrect approach that relies solely on historical vaccination protocols without reassessment fails to adapt to evolving disease pressures, emerging vaccine technologies, or changes in flock management, potentially leading to suboptimal protection and wasted resources. This could be considered a failure in professional diligence and a deviation from best practices in veterinary epidemiology. Another incorrect approach that prioritizes the cheapest available vaccine without considering its efficacy, safety profile, or suitability for the specific production system ignores critical factors that underpin successful disease prevention. This could lead to vaccine failure, economic losses due to disease, and potential regulatory scrutiny if the vaccine does not meet established standards for licensure or efficacy claims. This approach demonstrates a lack of professional responsibility in safeguarding animal health and producer interests. A third incorrect approach that disregards the producer's economic constraints and focuses exclusively on the most complex or expensive vaccination regimen without justification may not be practical or sustainable. While aiming for optimal protection, it fails to consider the economic realities of the operation, potentially leading to noncompliance or abandonment of the vaccination program. This highlights a failure to integrate veterinary recommendations with the client's operational capacity, a key aspect of ethical and effective veterinary consultation. The professional decision-making process for similar situations should involve a systematic evaluation of 1. Disease risk assessment, prevalence, incidence, economic impact. 2. Flock-specific factors, age, health status, management practices, biosecurity. 3. Vaccine evaluation, efficacy, safety, duration of immunity, route of administration, manufacturer reputation, CVB licensure. 4. Economic considerations, cost-benefit analysis of vaccination vs. disease impact. 5. Regulatory compliance, adherence to USDA CVB regulations and state veterinary practice acts. 6. Producer consultation and communication. This comprehensive framework ensures that vaccination strategies are tailored, effective, and ethically sound. Question 12. Operational review demonstrates a sudden increase in mortality and decreased egg production in a large commercial layer flock. Gross examination of necropsied birds reveals multifocal necrotic foci in the liver and spleen, and thickened intestinal walls with petechial hemorrhages, which diagnostic approach, when combined with appropriate clinical and epidemiological data, is most likely to yield a definitive diagnosis and guide effective flock management under USDA APHI's guidelines for avian health. Option A. Conducting serological testing for a broad range of avian pathogens without correlating with clinical signs or gross lesions. Option B. A comprehensive diagnostic strategy including gross pathology, histopathology of affected tissues, and targeted molecular diagnostics, e.g. PCR for common enteric and hepatic pathogens. Option C. Performing only molecular diagnostics on fecal samples without initial gross examination or histopathology of affected tissues. Option D. Sole reliance on gross pathological findings, assuming the characteristic lesions are pathognomonic for a specific disease. Correct answer is B. A comprehensive diagnostic strategy including gross pathology, histopathology of affected tissues, and targeted molecular diagnostics, e.g. PCR, for common enteric and hepatic pathogens. Explanation. This scenario is professionally challenging because it requires the veterinarian to balance the urgency of disease detection with the need for accurate, reproducible diagnostic results, all while adhering to specific regulatory requirements for poultry health and food safety. The veterinarian must consider the limitations and strengths of various diagnostic techniques in the context of a commercial poultry operation, where rapid decision-making is critical for economic viability and public health. The correct approach represents best professional practice because it prioritizes a multifaceted diagnostic strategy that leverages the strengths of different techniques to achieve a definitive diagnosis. This aligns with the principles of good veterinary practice and regulatory compliance, ensuring that interventions are based on sound scientific evidence. Specifically, using a combination of gross pathology, histopathology, and molecular diagnostics provides a comprehensive picture, increasing the likelihood of identifying the causative agent and its virulence. This approach is supported by guidelines from organizations like the American Association of Avian Pathologists, (AAP), and regulatory bodies such as the USDA's Animal and Plant Health Inspection Service, APHIs, which emphasize thoroughness in disease investigation to prevent widespread outbreaks and protect the food supply. An incorrect approach that relies solely on gross pathology is professionally unacceptable because macroscopic lesions can be suggestive, but are often not pathognomonic. This can lead to misdiagnosis, delayed or inappropriate treatment, and potential spread of disease, violating the veterinarian's ethical duty to provide competent care and regulatory obligations to report and control disease. Similarly, an approach that exclusively uses serology without considering other diagnostic modalities can be misleading. Serological tests indicate exposure to an agent, but do not confirm active infection or the presence of the agent in tissues, which is crucial for determining the source and extent of an outbreak. This could lead to incorrect management decisions and potential noncompliance with reporting requirements if active disease is present but not confirmed. An approach that focuses only on molecular diagnostics without initial gross examination or histopathology might miss important contextual information about the disease process and tissue damage, potentially leading to an incomplete understanding of the pathology and an over-reliance on a single data point. The professional decision-making process for similar situations should involve a systematic evaluation of the clinical signs, epidemiological data, and available diagnostic resources. The veterinarian should consider the differential diagnoses, the sensitivity and specificity of various tests, the cost-effectiveness, and the regulatory implications of each diagnostic choice. A tiered approach, starting with less invasive and more rapid methods, like gross examination, and progressing to more definitive techniques, like histopathology and molecular testing, as needed, is often the most prudent and scientifically sound strategy. Collaboration with diagnostic laboratories and regulatory authorities is also essential to ensure that diagnostic efforts meet all legal and ethical standards. Question 13. The efficiency study reveals that a new, more intensive feeding regimen for broiler chickens, involving significantly reduced space per bird and a higher stocking density, could increase feed conversion ratios by 5% and reduce overall production costs by 3%. However, preliminary observations suggest this increased density may lead to higher rates of lameness, increased aggression, and potential for feather pecking. As the consulting veterinarian, what is the most ethically and professionally responsible course of action? Option A. Advise the producer to immediately implement the new feeding regimen, emphasizing the substantial cost savings and potential for increased profitability, as the observed welfare issues are likely minor and manageable. Option B. Suggest a phased implementation of the new feeding regimen, starting with a small portion of the flock, to gather more data on welfare impacts before a full-scale adoption. Option C. Strongly advise against the new feeding regimen, citing the potential for significant animal welfare compromises that outweigh the projected economic benefits, and propose exploring alternative, less intensive methods for improving efficiency. Option D. Recommend the adoption of the new feeding regimen, provided that a comprehensive monitoring plan is implemented to track key welfare indicators, and that any significant welfare compromises are addressed promptly with corrective measures. Correct answer is D. Recommend the adoption of the new feeding regimen, provided that a comprehensive monitoring plan is implemented to track key welfare indicators, and that any significant welfare compromises are addressed promptly with corrective measures. Explanation. This scenario presents a professional challenge rooted in the inherent conflict between economic pressures and animal welfare, a core ethical consideration for poultry veterinarians. The veterinarian is tasked with balancing the financial viability of the operation with their professional obligation to ensure the health and well-being of the birds. The efficiency study highlights a potential for increased profit, but the proposed method raises significant welfare concerns. Careful judgment is required to navigate this ethical tightrope, ensuring that decisions are grounded in scientific evidence, regulatory compliance, and professional ethics. The correct approach prioritizes the welfare of the birds and adheres to established veterinary ethical principles and relevant U.S. regulations concerning animal husbandry and humane treatment. This involves a thorough, evidence-based assessment of the proposed management practice, seeking alternatives that achieve efficiency gains without compromising animal welfare, and transparent communication with the producer. Best professional practice dictates that animal welfare is paramount and should not be sacrificed for marginal economic benefit, especially when alternative, welfare-compatible solutions exist. This aligns with the principles of responsible veterinary care and the ethical guidelines of the American Veterinary Medical Association, AVMA, which are implicitly guiding principles for DACPV certification. An incorrect approach that immediately implements the proposed practice without further investigation or consideration of welfare implications demonstrates a failure to uphold professional ethical standards. This could be seen as a violation of the veterinarian's duty of care to the animals and potentially contravenes U.S. regulations that mandate humane treatment and prohibit unnecessary suffering. Another incorrect approach, focusing solely on the economic benefits without adequately assessing the welfare risks, neglects the veterinarian's responsibility to advocate for the animals. This demonstrates a lack of critical thinking and a failure to integrate welfare considerations into management recommendations, which is a cornerstone of poultry veterinary practice. A third incorrect approach, dismissing the producer's concerns about welfare without offering constructive alternatives, can damage the professional relationship and hinder the adoption of best practices. While the producer may be focused on efficiency, the veterinarian's role is to provide comprehensive advice that encompasses both productivity and welfare. The professional decision-making process for similar situations should involve a systematic evaluation. First, critically assess the proposed management practice for potential welfare impacts using scientific literature and established guidelines. Second, explore alternative strategies that could achieve similar efficiency goals with minimal or no negative welfare consequences. Third, engage in open and honest communication with the producer, presenting both the potential benefits and risks of the proposed practice, along with viable alternatives. Fourth, document all assessments, recommendations, and discussions thoroughly. Finally, always prioritize the welfare of the animals, ensuring that any management decisions are ethically sound and compliant with all applicable U.S. regulations. Question 14. Risk assessment procedures indicate a persistent increase in lameness and reduced growth rates in a specific line of broiler breeders. Post-mortem examinations reveal skeletal abnormalities, including shortened long bones and joint deformities, which are not consistent with common bacterial or viral infections. The producer is concerned about significant economic losses and potential implications for future breeding stock. Considering the potential for a heritable condition, what is the most appropriate course of action for the veterinarian to take? Option A. Immediately recommend culling all birds exhibiting lameness to prevent further spread and economic impact, without further diagnostic investigation. Option B. Advise the producer to adjust feed formulations to address potential nutritional deficiencies that could mimic skeletal abnormalities. Option C. Conduct a thorough diagnostic investigation including necropsy, histopathology of affected tissues, and consultation with poultry geneticists to confirm the suspected genetic disorder, assess its heritability, and develop a targeted management and potential genetic selection strategy. Option D. Rely on anecdotal information from other producers who have experienced similar issues and implement their suggested treatments. The correct answer is C. Conduct a thorough diagnostic investigation including necropsy, histopathology of affected tissues, and consultation with poultry geneticists to confirm the suspected genetic disorder, assess its heritability, and develop a targeted management and potential genetic selection strategy. Explanation. This scenario presents a professional challenge due to the inherent uncertainty and potential economic impact associated with genetic disorders in commercial poultry. The veterinarian must balance the need for accurate diagnosis and effective management with the economic realities of a production setting, while adhering to strict regulatory guidelines for disease reporting and biosecurity. The implications of a genetic disorder extend beyond individual bird health to flock productivity, potential transmission, if applicable to the specific disorder, and market access. Careful judgment is required to differentiate between a true genetic anomaly and other potential causes of poor performance or mortality, and to implement appropriate interventions that are both efficacious and economically viable. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based investigation that aligns with the principles of veterinary diagnostics and responsible flock management. This involves a thorough clinical examination, detailed history taking, and appropriate diagnostic testing to confirm the suspected genetic disorder. The subsequent steps of consulting relevant literature, collaborating with specialists, and developing a targeted management plan are crucial for informed decision-making. This approach ensures that interventions are based on sound scientific understanding and are tailored to the specific genetic condition and its impact on the flock, thereby minimizing economic losses and upholding animal welfare standards. Adherence to established diagnostic protocols and communication with the producer are paramount. An incorrect approach that focuses solely on symptomatic treatment without definitive diagnosis fails to address the root cause of the problem. This can lead to continued economic losses, potential masking of other underlying issues, and a lack of understanding of the disorder's prevalence and heritability within the flock. Ethically, this approach could be considered negligent if it delays or prevents appropriate management strategies. Another incorrect approach that involves immediate culling of affected birds without proper investigation might be economically driven, but can lead to unnecessary loss of valuable genetic material, and may not be the most effective long-term solution if the disorder is manageable or if its genetic basis is not fully understood. It also bypasses the diagnostic process necessary for accurate record-keeping and future breeding decisions. A third incorrect approach that relies on anecdotal evidence or unverified information from non-expert sources is professionally unacceptable. This deviates from the scientific rigor expected of a veterinarian and can lead to misdiagnosis, ineffective treatments, and potential harm to the flock. It also undermines the veterinarian's credibility and professional standing. The professional decision-making process for similar situations should involve a structured approach. 1. Thorough data gathering. Collect comprehensive clinical signs, mortality rates, production data, and management history. 2. Differential diagnosis. Develop a list of potential causes, including infectious diseases, nutritional deficiencies, environmental stressors, and genetic disorders. 3. Diagnostic investigation. Employ appropriate diagnostic tools, including necropsy, histopathology, genetic testing, if available and indicated, and other laboratory analyses. 4. Literature review and consultation. Access scientific literature and consult with specialists or colleagues to understand the specific disorder and its management. 5. Risk-benefit analysis. Evaluate the potential outcomes and costs associated with different management strategies. 6. Communication and collaboration. Maintain open communication with the producer, explaining findings, recommendations, and potential outcomes. 7. Implementation and monitoring. Develop and implement a management plan and monitor its effectiveness, adjusting as necessary. Question 15. Operational review demonstrates a poultry producer is considering the inclusion of a novel feed additive, marketed to improve feed conversion ratio and reduce the incidence of a specific enteric condition in broilers. The producer has provided marketing materials and anecdotal reports from other farms suggesting positive results. The veterinarian is tasked with evaluating the suitability of this additive for their operation under U.S. regulatory guidelines. Which of the following approaches best aligns with the regulatory framework for feed additives in the United States? Option A. Immediately incorporate the additive into the feed formulation, as the producer's anecdotal reports and marketing materials indicate a clear benefit and the cost savings are substantial. Option B. Advise the producer to consult with the additive manufacturer for their internal safety and efficacy data, and proceed with use if the manufacturer provides a letter of guarantee without further independent scientific evaluation. Option C. Rely solely on the producer's provided marketing materials and anecdotal evidence from other farms to justify the additive's inclusion, assuming that if it worked for them, it will work for this operation. Option D. Conduct a comprehensive risk assessment that includes a thorough review of peer-reviewed scientific literature, manufacturer-submitted efficacy and safety data, including toxicological studies and residue analysis if applicable, and an evaluation of potential adverse effects on animal health and food safety to determine if the additive meets FDA requirements for use. The correct answer is D. Conduct a comprehensive risk assessment that includes a thorough review of peer-reviewed scientific literature, manufacturer-submitted efficacy and safety data, including toxicological studies and residue analysis if applicable, and an evaluation of potential adverse effects on animal health and food safety to determine if the additive meets FDA requirements for use. Explanation. This scenario presents a professional challenge due to the inherent complexity of feed additive efficacy and safety, coupled with the need to adhere strictly to U.S. regulatory frameworks governing animal feed. The veterinarian must balance the potential benefits of a novel additive against potential risks to animal health, food safety, and compliance with FDA regulations. The challenge lies in moving beyond anecdotal evidence or manufacturer claims to a scientifically rigorous risk assessment that aligns with established regulatory pathways. The correct approach represents best professional practice because it directly addresses the U.S. Food and Drug Administration's FDA requirements for feed additives. Under the Federal Food, Drug, and Cosmetic Act, FFDCA, feed additives intended to affect the structure or function of animals or to improve feed efficiency are considered drugs or food additives and require pre-market approval or a demonstrated history of safe use. Comprehensive risk assessment, including evaluation of scientific literature, manufacturer data, and potential adverse effects, is crucial for determining if the additive meets the criteria for safety and efficacy as defined by the FDA. This aligns with the veterinarian's ethical and legal obligation to ensure the health and safety of the flock and the integrity of the food supply, as mandated by U.S. law. An incorrect approach that relies solely on anecdotal evidence or marketing claims fails to meet the regulatory burden of proof. The FDA requires scientific substantiation for efficacy and safety. Without this, the use of the additive could be considered an illegal drug or adulterant, leading to regulatory action, product recalls, and potential harm to animal health and public trust. Another incorrect approach, focusing only on cost-effectiveness without a thorough safety and efficacy evaluation, ignores the primary regulatory mandate. While economic factors are important in commercial poultry production, they cannot supersede the legal requirements for feed additive approval and safety. This approach risks introducing an unproven or unsafe substance into the feed supply, violating the FFDCA. The professional decision-making process for similar situations should begin with identifying the regulatory jurisdiction, in this case, U.S. FDA. Next, the veterinarian must determine the intended purpose of the feed additive and its classification under U.S. law. A thorough literature search and critical evaluation of available scientific data are essential. If the additive is novel or lacks established regulatory approval, a risk assessment framework that considers potential hazards, exposure, and risk characterization, in line with FDA guidelines, must be employed. This involves understanding the scientific basis for the additive's claimed effects, potential toxicological concerns, and any residue implications in food products. Collaboration with regulatory experts and manufacturers, while maintaining professional skepticism and independent scientific judgment, is also key. Question 16. Quality control measures reveal a consistent deficiency in essential amino acids in the current feed formulation for a commercial broiler flock, leading to suboptimal growth rates and increased susceptibility to secondary infections. The flock is nearing a critical growth phase, and immediate dietary adjustments are being considered. Which of the following actions represents the most appropriate and regulatory compliant approach to address this nutritional deficiency? Option A. Continue with the current feed formulation, attributing the suboptimal performance to environmental factors, and postpone any dietary changes until the next flock cycle. Option B. Consult the latest FDA guidelines for poultry feed formulation to identify approved protein supplements and their permissible inclusion rates, ensuring the chosen supplement provides the necessary amino acid profile without exceeding regulatory limits. Option C. Increase the overall feed volume offered to the flock, assuming this will compensate for the amino acid deficiency and improve growth rates without altering the existing feed composition. Option D. Immediately incorporate a readily available, less expensive alternative protein source that has been recommended by a neighboring farm, without verifying its specific amino acid content or regulatory approval status. The correct answer is B. Consult the latest FDA guidelines for poultry feed formulation to identify approved protein supplements and their permissible inclusion rates, ensuring the chosen supplement provides the necessary amino acid profile without exceeding regulatory limits. Explanation. Scenario analysis. This scenario presents a challenge because it requires the veterinarian to balance the immediate needs of a flock with the long-term implications of dietary adjustments, all while adhering to specific regulatory guidelines for feed additives and nutrient profiles. The potential for economic loss due to suboptimal performance or health issues, coupled with the risk of non-compliance with FDA regulations regarding feed formulation and labeling, necessitates a thorough and evidence-based decision-making process. Correct approach analysis. The correct approach involves consulting the most current FDA guidelines for poultry feed formulation, specifically focusing on the permissible levels and approved uses of specific protein sources and carbohydrate supplements. This ensures that any adjustments made to the feed formulation are compliant with federal regulations, preventing potential recalls, fines, or adverse health effects in the birds. It also aligns with the ethical obligation to provide safe and effective veterinary care, which includes ensuring the nutritional adequacy and regulatory compliance of animal feed. Incorrect approaches analysis. One incorrect approach would be to immediately switch to a readily available, cheaper protein source without verifying its regulatory status or nutrient profile against FDA standards. This could lead to the inclusion of unapproved additives or a deficiency in essential amino acids, violating FDA regulations on feed composition and potentially causing health problems. Another incorrect approach would be to solely rely on anecdotal evidence or recommendations from other producers regarding carbohydrate supplementation. This bypasses the regulatory requirement for scientifically validated feed formulations and could result in an imbalance of nutrients, impacting bird health and performance, and potentially contravening FDA guidelines on feed additive efficacy and safety. A third incorrect approach would be to ignore the quality control findings and continue with the current feed formulation, assuming the observed suboptimal performance is due to other factors. This demonstrates a failure to address a potential feed-related issue, which could lead to continued economic losses and a breach of the veterinarian's duty to provide competent care and ensure the well-being of the flock, potentially violating FDA regulations related to feed safety and efficacy. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough assessment of the problem, followed by a review of relevant regulatory requirements, in this case, FDA guidelines. This should then be followed by an evaluation of available scientific literature and expert consultation to determine the most appropriate and compliant course of action. Documentation of all decisions and justifications is crucial for accountability and future reference. Question 17. Strategic planning requires a veterinarian to assess the economic viability of a poultry operation. A producer is experiencing decreased feed conversion ratios and increased mortality in their broiler flock. They express concern about the cost of diagnostic testing and potential treatments, suggesting a focus on only the most inexpensive interventions. What is the most professionally responsible approach for the veterinarian to take in assessing and advising on flock profitability in this situation? Option A. Conduct a comprehensive diagnostic workup to identify the underlying causes of poor performance and mortality, and then present a cost-benefit analysis of evidence-based treatment and management strategies that promote long-term flock health and economic sustainability. Option B. Recommend the least expensive symptomatic treatments available, prioritizing immediate cost reduction for the producer, and defer further investigation until the current flock is processed. Option C. Suggest the use of unproven or anecdotal remedies that are known to be inexpensive, with the understanding that these may not be fully effective but could offer some cost savings. Option D. Advise the producer to continue with their current feeding program and management practices, as the cost of any intervention may outweigh the potential gains given the current market conditions. The correct answer is A. Conduct a comprehensive diagnostic workup to identify the underlying causes of poor performance and mortality, and then present a cost-benefit analysis of evidence-based treatment and management strategies that promote long-term flock health and economic sustainability. Explanation. This scenario presents a professional challenge because it forces a veterinarian to balance the immediate financial pressures of a client with the long-term health and profitability of the client's flock, while adhering to professional ethical standards and regulatory guidelines. The veterinarian must assess profitability not solely on immediate cost savings, but on sustainable production and disease prevention, which are core to poultry health and economic viability. The correct approach represents best professional practice because it prioritizes a holistic, science-based assessment of flock profitability. This involves considering all relevant factors, including disease prevention, feed conversion efficiency, mortality rates, and market value of the birds, in conjunction with treatment costs. This aligns with the veterinarian's ethical obligation to act in the best interest of the animal and the client's business, as guided by the principles of veterinary practice and the American College of Poultry Veterinarians' commitment to advancing poultry health and welfare. It also implicitly adheres to regulatory frameworks that expect veterinarians to provide sound, evidence-based advice that promotes animal health and food safety. An incorrect approach that focuses solely on minimizing immediate treatment costs without considering the underlying causes of poor performance or the potential for disease spread is ethically flawed. It fails to uphold the veterinarian's duty of care, potentially leading to prolonged suffering, increased mortality, and greater long-term economic losses for the producer. This could also violate regulations pertaining to animal welfare and responsible use of veterinary services. Another incorrect approach that involves recommending unproven or off-label treatments to reduce immediate expenses without proper scientific validation or consideration of withdrawal times poses significant risks. This not only compromises animal welfare, but also jeopardizes food safety and could lead to regulatory violations concerning drug residues and product integrity. Such actions undermine the credibility of the veterinary profession and the poultry industry. A third incorrect approach that involves deferring to the client's financial demands without providing professional veterinary judgment, even when that judgment indicates a different course of action is necessary for flock health and profitability, is also problematic. While client communication is vital, a veterinarian cannot abdicate their professional responsibility to provide expert advice. This failure to guide the client based on veterinary expertise can lead to suboptimal outcomes and potential regulatory scrutiny if animal welfare or food safety is compromised. The professional decision-making process in such situations should involve a thorough diagnostic workup, a comprehensive assessment of flock health and production parameters, and open communication with the producer about the findings and recommended strategies. This includes clearly articulating the rationale behind treatment and management recommendations, explaining the potential short-term and long-term economic implications of various approaches, and collaboratively developing a plan that balances immediate financial concerns with sustainable flock health and profitability. Question 18. The evaluation methodology shows a poultry producer is considering modifying their existing broiler housing system to incorporate enhanced ventilation and lighting controls, aiming to improve bird welfare and potentially reduce mortality. As the consulting veterinarian, what is the absolute priority when advising on these proposed modifications, strictly adhering to the regulatory framework for poultry operations in the United States? Option A. Focus on implementing the most cost-effective ventilation and lighting upgrades that offer a perceived improvement in bird comfort without extensive regulatory verification. Option B. Recommend modifications based on the latest peer-reviewed scientific literature on broiler welfare, assuming these practices will inherently comply with all relevant U.S. regulations. Option C. Advise the producer to adopt practices commonly used by other successful large-scale poultry operations in the U.S., as these are likely to be compliant. Option D. Prioritize a comprehensive review of all applicable U.S. federal and state regulations pertaining to poultry housing and environmental controls, ensuring any proposed modifications meet or exceed these legal mandates. Correct answer is D. Prioritize a comprehensive review of all applicable U.S. federal and state regulations pertaining to poultry housing and environmental controls, ensuring any proposed modifications meet or exceed these legal mandates. Explanation. Scenario analysis. This scenario presents a common challenge in poultry production, where a producer is seeking to implement changes to their housing system. The challenge lies in balancing the desire for improved animal welfare and potentially increased efficiency with the absolute requirement to comply with established U.S. federal and state regulations governing poultry housing and environmental control. Failure to adhere to these regulations can result in significant penalties, including fines, loss of permits, and reputational damage. The veterinarian's role is to provide expert guidance that is both scientifically sound and legally compliant. Correct approach analysis. The correct approach involves a thorough review of applicable U.S. federal regulations, such as those promulgated by the USDA's Food Safety and Inspection Service, FSIS, concerning humane handling and slaughter, and any relevant state-level regulations or guidelines that may impose stricter requirements on housing and environmental control for poultry. This approach ensures that any proposed changes are evaluated against the established legal framework, prioritizing compliance and animal welfare, as mandated by law. It demonstrates best professional practice by grounding recommendations in regulatory adherence, thereby protecting the producer from legal repercussions and ensuring the welfare of the birds is met at a minimum legal standard. Incorrect approach is analysis. One incorrect approach would be to solely rely on industry best practices or anecdotal evidence from other producers without verifying their compliance with U.S. federal and state laws. This is a regulatory failure because industry best practices, while often beneficial, are not legally binding and may not meet the minimum standards set forth by regulatory bodies. Another incorrect approach is to implement changes based on personal opinion or a perceived understanding of animal welfare without consulting the specific legal requirements. This is an ethical and regulatory failure, as it bypasses the established legal framework designed to protect animal welfare and ensure fair practices. Finally, focusing only on cost-effectiveness without considering regulatory compliance is a significant professional and legal misstep. Regulations are in place to ensure a baseline of welfare and safety, and prioritizing cost over these mandates is a direct violation of professional responsibility and legal obligations. Professional reasoning. Professionals must adopt a systematic approach that begins with identifying all relevant regulatory frameworks. This involves consulting official government websites, USDA, state departments of agriculture, relevant statutes, and administrative codes. Once the regulatory landscape is understood, proposed changes should be evaluated for their impact on compliance. If changes are contemplated, a proactive step is to seek clarification from regulatory agencies if any aspect of the proposed modifications is unclear. Documentation of this process, including the regulations consulted and the rationale for decisions, is crucial for demonstrating due diligence and professional accountability. Question 19. The audit findings indicate a need to review the vaccination protocols for a large commercial broiler operation. The veterinarian is presented with several options for addressing a potential threat of infectious bronchitis. Which of the following vaccine strategies best aligns with current U.S. regulatory frameworks and best practices for poultry vaccination? Option A. Recommend the use of an autogenous infectious bronchitis vaccine developed from local field isolates, without prior consultation with regulatory authorities regarding its approval status. Option B. Utilize a killed infectious bronchitis vaccine administered via injection, even though the flock is nearing market weight and the disease threat is acute. Option C. Administer a live infectious bronchitis vaccine via drinking water, ensuring proper handling and administration techniques are followed, and that the vaccine is licensed by the USDA for use in broilers. Option D. Select a live infectious bronchitis vaccine that has demonstrated efficacy in layer hens, but is not specifically licensed or recommended for broiler chickens by the USDA. The correct answer is C. Administer a live infectious bronchitis vaccine via drinking water, ensuring proper handling and administration techniques are followed, and that the vaccine is licensed by the USDA for use in broilers. Explanation. The audit findings highlight a common challenge in poultry health management, ensuring the appropriate and effective use of vaccines. This scenario is professionally challenging because it requires a veterinarian to not only understand the theoretical aspects of poultry vaccines, but also to apply this knowledge within the specific regulatory framework governing veterinary practice and drug/vaccine use in the United States, as dictated by the DACPV exam's jurisdiction. The veterinarian must critically evaluate different vaccine types and their application based on efficacy, safety, target pathogens, and the specific production system's needs, all while adhering to U.S. regulations concerning vaccine administration, record keeping, and product labeling. The correct approach represents best professional practice because it demonstrates a thorough understanding of the principles of immunology and vaccinology as applied to poultry, coupled with a commitment to evidence-based decision-making. This involves selecting vaccines that are licensed for use in the U.S., are appropriate for the specific poultry species and disease challenges faced by the flock, and are administered according to manufacturer guidelines and veterinary recommendations. This aligns with the principles of responsible veterinary medicine and the regulatory requirements for drug and vaccine use in the U.S., ensuring animal welfare and food safety. An incorrect approach that suggests using a live vaccine in a flock with a history of immunosuppression, without proper pre-vaccination assessment, or consideration of alternative vaccine types would be a significant regulatory and ethical failure. This could lead to vaccine failure, increased disease incidence, and potential condemnation of birds, violating the veterinarian's duty to provide competent care and potentially contravening FDA regulations regarding the use of approved biologics. Another incorrect approach, such as recommending a killed vaccine for a rapidly developing disease outbreak, where a faster-acting live vaccine might be indicated, would demonstrate a lack of understanding of vaccine kinetics and disease dynamics, leading to suboptimal flock protection and potential economic losses, which is a failure in professional judgment. Recommending a vaccine not approved by the USDA for use in the U.S. poultry population would be a direct violation of federal regulations governing veterinary biologics. The professional reasoning process for similar situations should involve a systematic evaluation of the flock's health status, epidemiological history, specific disease risks, available vaccine options, considering their type, efficacy, safety, and regulatory approval in the U.S., the production system's management practices, and economic considerations. This should be followed by consultation of current scientific literature, manufacturer's product information, and relevant regulatory guidelines. The veterinarian must then formulate a vaccination program that is scientifically sound, ethically responsible, and legally compliant. Question 20. Compliance review shows a broiler producer is proposing to switch to a new, lower-cost feed formulation that includes a novel ingredient sourced from a supplier with less established traceability. The producer believes this change will significantly reduce feed costs. What is the most appropriate veterinary response to ensure compliance with U.S. regulatory frameworks and uphold professional standards? Option A. Immediately approve the feed change to support the producer's cost-saving initiative, assuming the supplier's claims are accurate and no immediate adverse effects are observed. Option B. Recommend the producer source a similar, but more established, feed ingredient from a different supplier without verifying the safety or regulatory compliance of the proposed novel ingredient itself. Option C. Conduct a thorough review of the new feed ingredient safety data, regulatory approval status, e.g., FDA GRAS notification or approved additive status, and potential impact on bird health and food safety, consulting relevant FDA and USDA guidelines before advising the producer. Option D. Advise the producer to continue with the current feed formulation, as any change involving a less established supplier introduces unacceptable risk without further investigation. The correct answer is C. Conduct a thorough review of the new feed ingredient safety data, regulatory approval status, e.g., FDA GRAS notification or approved additive status, and potential impact on bird health and food safety, consulting relevant FDA and USDA guidelines before advising the producer. Explanation. Scenario analysis. This scenario presents a common challenge in broiler production where a perceived immediate economic benefit, reducing feed costs, conflicts with established animal welfare and food safety regulations. The veterinarian must balance the producer's financial interests with their professional and legal obligations to ensure the health and welfare of the birds and the safety of the food supply. The pressure to cut costs can lead to decisions that compromise these critical areas, making careful judgment and adherence to regulatory frameworks paramount. Correct approach analysis. The correct approach involves a thorough, evidence-based assessment of the proposed feed change. This aligns with the veterinarian's professional responsibility to act in the best interest of animal health and welfare, as well as public health. Specifically, it requires consulting relevant U.S. Food and Drug Administration, FDA, regulations concerning animal feed additives and drug residues, e.g., 21 CFR Part 500 series, and the U.S. Department of Agriculture, USDA guidelines on poultry health and food safety. A veterinarian must verify that any new feed ingredient or formulation does not introduce unacceptable risks of drug residues, antimicrobial resistance, or adverse health effects in the birds, which could impact food safety and marketability. This proactive, data-driven approach ensures compliance with federal regulations and upholds the highest standards of veterinary practice. Incorrect approaches analysis. One incorrect approach involves immediately approving the feed change based solely on the producer's assurance of cost savings. This fails to meet the veterinarian's duty of care and regulatory oversight. It bypasses the critical step of verifying the safety and efficacy of the proposed feed alteration, potentially leading to violations of FDA regulations regarding feed safety and drug residues. Such an approach could result in contaminated poultry products, leading to significant public health risks and severe legal and financial repercussions for the producer and the veterinarian. Another incorrect approach is to dismiss the producer's request outright without any investigation. A caution is warranted. A complete refusal without understanding the proposed changes or exploring potential compliant alternatives is not best professional practice. It can damage the veterinarian-producer relationship and miss opportunities to optimize flock health and production within regulatory boundaries. This approach lacks the problem-solving and consultative aspect expected of a veterinary professional. A third incorrect approach is to rely on anecdotal evidence or past practices from other operations without specific verification for the current flock and facility. Regulations are specific, and what may have been acceptable or unverified in the past, or in a different context, may not be compliant now or under current scrutiny. This approach risks overlooking new regulatory requirements or emerging scientific understanding of feed safety and its impact on animal health and food safety, potentially leading to noncompliance with current FDA and USDA standards. Professional reasoning. Professionals should approach such situations by first understanding the proposed change and its rationale. This involves open communication with the producer. Next, the veterinarian must systematically evaluate the proposal against all applicable U.S. federal regulations, FDA, USDA, and established veterinary best practices. This includes reviewing scientific literature, consulting regulatory guidance documents, and, if necessary, conducting trials or seeking expert opinions. The decision-making process should prioritize animal welfare, food safety, and regulatory compliance, while also considering economic viability in a responsible manner. If the proposed change cannot be verified as safe and compliant, the veterinarian must clearly articulate the risks and regulatory concerns to the producer and recommend alternative compliant solutions.